Ladies and gentlemen, dear colleagues, dear friends, most welcome to this digital event, Looking Ahead, Post-Pandemic Recovery, Restoration and Preservation of Professional Services by Pharmacists, organized by the International Pharmaceutical Federation, FIPP, in collaboration with the Hospital Pharmacy Section, Clinical Biology Section, and the Community Pharmacy Section of FIPP. Next slide, please. My name is Lars-Åke Söderlund, and I am the president of the Community Pharmacy Section, FIPP. I have the great honor and pleasure of co-chairing this event together with my colleagues, Robert Moss and Julian von Sart, and they will shortly introduce themselves as well. Before we start our event, let's look at some housekeeping rules for today's session. This webinar and digital event is being recorded and live streamed via YouTube and via the FIPP events webpage. The recording will be available on our website, www.events.fipp.org. And you may ask questions using the question box provided. And please don't submit questions in the chat forum, as these questions might be missing among all other comments. So please use the question box for your questions to our speakers. You are most welcome to provide us with your feedback to webinars@fipp.org. By doing this, we can furthermore improve our future events. And I encourage you to become a member of the one and only global pharmacy organization covering research, education, and pharmacy practice. It might be the best investment you have ever made, and all details can be found at our website, fipp.org. Next slide, please. As I mentioned earlier, FIPP is the only global pharmacy organization with more than 140 member organizations worldwide, supporting more than 4 million pharmacists, all categories in all settings. FIPP is essential for the development of pharmacy, and this has been more evident than ever before during the last years. FIPP, uniting pharmacy around the world. The mission of FIPP is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And the vision of FIPP is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration with other healthcare professionals. Next slide, please. At today's event, we are very happy to introduce to a number of global leaders of pharmacy who have been highly involved with the pandemic and the development of pharmacy services in their respective countries. Our excellent panel consists of Amrahi Buang, President of the Malaysian Pharmaceutical Society, Mariette Eckstein, Professional Development and Support, Pharmaceutical Society of South Africa, Chris Freeman, National President, the Pharmaceutical Society of Australia, Ana Paula Martins, President of the Portuguese Pharmaceutical Society, Ziya Nassour, former President of the Lebanese Order of Pharmacists, Ismail Olmos, Head of the Pharmacy Department and member of the Clinical Pharmacology Unit, Hospital Vilar-de-Bo, Uruguay, András Süle, President of the European Association of Hospital Pharmacists from Hungary and Belgium, and Esteban Zavaleta, Director of Pharmacy, Hospital Clínica Bíblica, Costa Rica. Most welcome, all of you. It is indeed a great honor to have you all with us today. Robert, one of my co-chairs, what is the aim of today's event?
Thank you very much, Lars-Åke, for handing the word to me. Hello, first let me shortly introduce myself. I'm Robert Moss. I'm currently the president of the Hospital Pharmacy Section of the International Pharmaceutical Federation. I'm very glad to have this distinguished panel here. And of course, the pandemic has really challenged us in personal lives, both by lockdowns and all the things, but perhaps also by personal losses due to the pandemic. But most certainly, it also has had a lot of impact in in our professional lives. So what we're hoping here is to have a webinar with experts from all over the world to provide different perspectives on how the pandemic has impacted the scope of their services provided by pharmacists in both the community, hospital, and clinical biology settings. It will be a roundtable discussion, and a panel of experts in different areas will share their thoughts in which services were suspended or deprioritized and which need to be recovered or restored, and which new services emerged and may need to be preserved beyond the pandemic. So I really hope that you will enjoy this. And Julien Fonsard, please, can I give you the floor for the learning objectives?
Yes, thank you, Rob. Okay, welcome everyone, sorry. So I'm Julien, I'm from France, and I'm actually the president of the clinical biology section of FIPP. Today, we have two learning objectives. First, to understand the impact of the pandemic on the scope of services pharmacies provide in the different settings, and to discuss the priorities in the restoration and recuperation of services across the different regions on area of practice. And thank you everyone to be here today.
Thank you so very much, all of you. And it's really nice to start the panel discussion. I would like to raise a question to Amra from Malaysia. The pandemic has represented a catalyst or accelerator of new services. If you had to highlight one professional service or activity introduced or expanded during the pandemic in your country that we should preserve beyond the pandemic, what would it be? And when it comes to this specific service, was it necessary to provide additional training or tools to your pharmacists in your country for these services?
Thank you, Lars. First of all, I would like to introduce myself. I'm Amrahi, the president of the Malaysian Pharmacy Society. So greeting to all. Thank you for the invite to share my thoughts regarding what is happening during the pandemic. So during the pandemic, one of the things that actually came out in Malaysia, there's actually an opportunity, as you know, that the pandemic actually caused what you call a lot of things to all of us in terms of life and livelihood. And one of the things that we have done in Malaysia in terms of this service is actually the quit smoking that we have under our MQuit program. Yeah, previously, we don't have this, but with the pandemic, it accelerates the role of the pharmacist to provide this MQuit, the quit smoking service. And MPS is actually given the responsibility to lead in this country. And we hope that this is the starting of the contribution of pharmacists in Malaysia in terms of providing, because the quit smoking is very related to the effect of the virus, to people, because it will cause a lot of comorbidity and causality. So I think one of the things that I want to tell the world is the fact that pharmacists in Malaysia are able to provide these MQuit services that will actually help. And this is actually a national event, because this is highly supported by our government. So if you ask me, so that is the thing that we are going to do, and we're going to continue to do even for post pandemic. Just to share the experience of one activity that we have in Malaysia.
And thank you so very much, Amrai. Was it also necessary to provide specific education for your pharmacists before you started these services?
Yeah, previously, you see, when you want to provide these services, we have to pass certain, certification. We have our CSP, to provide the training for our pharmacists, to be certified. We have level 1 and level 2, and only those who actually have this certificate actually can provide this service. And under this new thing, is all in one platform, and we are able to utilize this service as of now in terms of providing this services to the Malaysian public.
Thank you so very much.
And sorry, and also this part is part of the, you see, in Malaysia now we have our we call it My Sejahtera, you know, an application in Malaysia where of the My Sejahtera. So population actually can access to us via the My Sejahtera apps.
Thank you so very much, Amri. Marriott, if we go to South Africa, would you say that this is also the most important service that you would like to preserve in relation to the pandemic?
Thank you so much, colleagues, and good afternoon to everybody that's joining us this afternoon. I totally agree. And I think the sad part is that it had to take a pandemic for the value of pharmacists to be realized. So in South Africa, pharmacists do have vaccination rights. It's part of our undergraduate curriculum. It's part of the services that a pharmacist can offer in a community or in a hospital pharmacy. But the hiccup sometimes is access to the injections or to the scheduled vaccinations. Certain vaccines or injections is available without a prescription, but others, and specifically in this case, the COVID-19 vaccine, is on a schedule that requires a prescription by an authorized prescriber. But as you can imagine, you know, to generate 40 million prescriptions to bring us to herd immunity is just practically not achievable. And our South African Pharmacy Council actually took a big step in this, in generating a Section 22A15, that's within our Medicines Act, permit for a pharmacist to access the COVID-19 vaccine, as well as the injectables needed to treat anaphylactic shock, to give pharmacists access to those medications. That was done without additional training, and because pharmacists do have vaccination rights, but if a pharmacist felt they wanted to refresh their injection technique, that's totally up to them. But this additional permit, which is a duration of 5 years, issued to individual pharmacists, really have broadened the scope, and I think highlighted the role of the pharmacist, not only in COVID-19 vaccination, but in general vaccination for vaccine preventable diseases. And I think that is intensely important.
Thank you so very much, Marriott. If we go to Australia, what is your perception, Chris, when it comes to the services from the community pharmacy?
Thank you, Lars, and thank you to FIPP for the invitation to join the webinar today. From Australians' perspective, there are a few things, but I'll focus on two linked components. The first is the ability for pharmacists to dispense electronic prescriptions. Of course, with the pandemic, there were widespread lockdowns and closures where people's movement to and from work and other places was limited, which meant that medical consultations required telehealth consultations. So the patient wasn't physically seeing their doctor. At the end of that consultation, obviously one of the potential outcomes was the prescription of a medicine, which then left the problem of how would that person have that medicine dispensed for them. Australia was on a pathway to electronic prescriptions anyway, but it was at a very, very slow rate. And there was a whole lot of behaviour change that was going to occur alongside with that. When the pandemic struck, there was rapid escalation of this type of service. Initially, it was a service called digital image prescribing, where it was just a paper prescription where a photograph or a photocopy was taken and then that was supplied to the pharmacy. Now we've moved to fully electronic prescriptions where the prescription is uploaded by the prescriber into the cloud and that can be drawn down by the pharmacist. And again, the patients may not physically need to present then to the pharmacy to have it dispensed, or they can also do that. So we saw rapid escalation of electronic prescribing based on the necessity because of the pandemic. And related to that, in Australia, we had an emergency supply arrangement where if a person without a prescription required continued supply of their medicine, we were able to legally only supply 3 days worth of that medicine. Of course, that became hugely inconvenient for people who are on long-term stable medicines who needed a full month's supply of their medicines. So with some advocacy from the Pharmaceutical Society, we were able to move the emergency supply provisions to a continued dispensing arrangement where the pharmacist was able to supply the person with a whole prescription of their medicines if they had already previously been prescribed. So those were the two advances that came from the pandemic here in Australia.
Thank you so very much, Chris. Indeed, different services being developed in different parts of the world due to the pandemic, and of course in the needs of each country or in the context of every country. Robert, over to you. How is the situation within hospital pharmacy? I think we are muted.
Sorry about that. Yeah, very interesting to hear all the different approaches that are already being taken. But indeed, I would very much like to hear Esteban, being in a hospital setting, the same question there. What are the sort of things that you really was new at this point? But in a minute,
yeah. Thank you, Robert. Yes, indeed, we have to implement several strategies to improve patients' care. For instance, and something that really called my attention is that our Ministry of Health permitted the delivery, the home delivery of medications for certain patients, especially for outpatient, for patients who were at home with chronic diseases. And we really believe it was really important because we didn't want elderly patients to approach the hospitals if they were sane without any disease, but they were in a high-risk population. So many hospitals, whether private or public hospitals, implemented the home delivery of medications. And I think that really worked good for patients, you know, for that reason, because it avoided them to go to a hospital where hospitals all around the world were really full of COVID-19 patients, and that really presented a risk for them. And also we implemented the electronic prescription for opioids. So for patients with terminal diseases, that was something really good for them to stay at home and being able to send those kind of medications coordinated, of course, by the pharmacist and dispensed also by a pharmacist to their home without any contact to any hospital.
Thank you very much. And what I'm very interested, Andras, you are representing sort of the president of the EHP, so a broad domain what has been happening in Europe. Perhaps you could, so it'd be interesting to take your view, what you saw as a sort of a common or whatever you think you might highlight in this respect.
Thank you, Robert, and good afternoon to everyone. EHP being an umbrella organization in this way, quite similar to FIPP, we are having the privilege to look at the whole European landscape from a little bit broader angle, probably. And what we saw was a rather interesting dynamic of new challenges or new roles that were fostered by the striking of the first, second, and third waves of the pandemic. And in particular, I think during the first wave, our most important challenges were to more focus on the product side of our profession. So we had to help coming up with solutions to shortages, especially for ICU products. And also compounding during this time was really high up on our agenda, especially for antiseptics and some personally tailored medications. But with the advent of the second and third waves, I think the clinical side of hospital pharmacy was put to a larger test. And this came as a new advent for roles changing for hospital pharmacists, especially on COVID wards, where novel therapeutic modalities, repurposed medications really asked for some deep knowledge in terms of how to interpret evidence-based data and actually recognize proper evidence behind certain views on what could be used and what could not be used. And then with the third wave, I think hospital pharmacists were also put to the test in the vaccination centers, just like we have previously heard from South Africa. And we have seen that throughout Europe, that many hospital pharmacists were deeply involved in the running of vaccination centers, both from the preparation side and some cases also in the administration side of the tasks. So consequentially, I would think that it was basically the clinical side of pharmacy services that we are supporting is the part that have increased during the pandemic, and that kind of heralds this shift towards a team-based healthcare approach. And the pandemic has most definitely accelerated this development, and probably also has shown or highlighted that the involvement of hospital pharmacists in frontline patient care is a must, or at least it has obvious benefits for the patient.
Great, wonderful. Thank you very much, Andras. Very interesting to see that perspective from that side too. Julian, perhaps because this is very much about the side of therapeutics, but I'm sure we have colleagues here that are very knowledgeable on the clinical biology side. Julian, would you like to take over some questioning here?
Yes, thank you, Rob. So I don't know, but any of you have done some testing for COVID-19 or deployed any testing procedure? And what was the challenging of that? Any of you? I don't know if you want to answer.
I see Chris has raised his hand.
Sorry. Go on, Chris.
Yeah, thank you. In Australia, we had long health policy debates around the best way to undertake COVID-19 testing. Mostly this has been run through jurisdictional large-scale centres. And initially during the pandemic, where community pharmacy was identified as a potential location for COVID-19 testing, there were some concerns raised. Those were patients who were potentially infectious, turning up to pharmacies, which are crowded places with potentially frail and sick other patients, and causing further infection in that setting. That would also have an impact on the potential business, in which that pharmacy may then need to close for a deep cleaning should infection be spread in that method. We have had one trial here in Australia, in South Australia, and a proposed trial in Queensland. My understanding is those sites have been limited in the number of patients they've actually physically tested. And so while community pharmacy, from an access point of view, offers an ideal situation to offer COVID testing, in the depths of the pandemic, where numbers were high here in Australia, there was concern from our members that that would actually put themselves and their staff at risk, but also the other patient population which didn't currently have COVID. So in Australia, pharmacists have not been significantly involved in COVID testing.
Okay, thank you, Chris. I don't see any other.
Anna, I think, has raised her hand.
Julian.
Yeah.
Anna?
Hi.
Sorry.
Thank you. Thank you so much for giving me the word. So first of all, let me just thank you, FIP, for these invitations, and let me greet all the colleagues around the world for being here and for the excellent, extraordinary work that pharmacists have been doing during the pandemics that I think excel, as already have been said for the other colleagues in the panel, that is really bolding and excelling what we are able to do for health coverage and health for all. So I would like to respond to what Julian raised, that is, in Portugal, we were, let's say, we were involved, I wouldn't say from the beginning, because the debate, as already been said, started with the government several months ago about the possibility of having pharmacies, the network of pharmacies, involved in the testing, for COVID-19. But now we are undertaken a very large, let's say, it's not a campaign, but a program of testing in the pharmacies in all the countries. So last week, the government decided to reimburse the tests that are, the rapid tests, the PCR rapid tests that are being doing in the pharmacy and in the labs. I would say the small labs and the bigger labs that are doing this work for more than almost 1 year. So again, the importance of this decision from the government is that they are putting exactly at the same level all the tests that were only done until 2 weeks, 3 weeks ago. They were reimbursed by the health system, the national health system, only in labs and in big centers for testing, big testing centers. And now the community pharmacies are able to perform these tests like the other settings, being reimbursed by the national health system and in the maximum of 4 tests per citizen per month. And I think this was, I would say, a big effort from the government to, leverage the points of tests for the Portuguese citizens, but also new responsibility, a new service that pharmacists can provide and are providing with a large success. Of course, that we can discuss, we do not have time today for that. It's not the most important thing, but of course that the pharmacists are not very happy with the reimbursement that was, defined by the government, because it's very, very low and is not, I would say, paying all the costs that we have with with all the materials and equipments that we have to, and the time that we have to allocate, the resources that we have to allocate to these tests. But I think, honestly, that is it's a step further in the services, in the proximity services that that pharmacists can provide in this area. And let me just add, to finish, that the link and the relationship between pharmacies from the biology tests, from the clinical and clinical lab tests, and from the community pharmacies is doing very well. As you know, being very open, it is sometimes it was in the past it was a tension area. And we have to understand why was an attention area, because there is a limit. There is a limit, a professional limit, where the pharmacists in the community can perform these type of tests. But actually, in this case, with the type of tests we have now, these rapid tests, I would say that has been a very interesting and positive experience, that all the pharmacists are united, you know, providing and talking and you know, helping each other in a very good interprofessional relation, that allowed us to make to deliver a very good service in the pharmacy and in the labs, the small labs of that are very close to the citizens.
Thank you, Anna. Yes, we have to work together. Yes, it's the only way to contain this pandemic. Ismail, you want to add something?
Hi, hello, everyone. It's a pleasure to me here share our experience around the world. Well, I'm from Uruguay, a small country in South America. We have 3.5 million people. And in this point, in this day, the government in Uruguay is publishing a decree where some tests for detection of coronavirus infection will be performed exclusively in pharmacies under supervision of pharmacists. I think this is very important for us. It puts an important role in the fight against the pandemic. I also think that something we should learn from the pandemic is the risk run with health communication problems. Is something important for us to be part of the education of all the people. In Uruguay, we are working, as Chris was saying, about the prescription, the electronic prescription, and we are working very, very hard in this. We are trying to make our national medicines dictionary, where all the medicines are trying to put in one language that everybody could understand, that is known CT. We are working very hard in this. And with the electronic prescription, everybody could dispense in a pharmacy from an electronic prescription. We are working very hard in this. It is something that pharmacies are working hard. Thank you.
Great, thank you very much, Ismail. I think we should be slightly wondering, because the good thing is that we've seen things come up and pop up as new ideas, and which is great, and giving new opportunities. The downside very often is you have to set priorities. So sometimes you just, there are services that we had to discontinue due to whatever reasons, and deprioritize during the pandemic. So which of these services, perhaps you can name a few or one or two, and which ones do you think it has really a great priority in recovering the pandemic? And I would like to ask Ziya, our Lebanese member, because I think your country is specifically hard hit both by the pandemic, but also about the economic situation in your country. So I'm really, Ziya, if you could explain some things going on in your country.
Thank you very much. Good afternoon, everybody. First of all, let me say that all sections, pharmacy sections in Lebanon, are doing well with this pandemic. At the hospital pharmacies, they are dealing with the vaccination. They are preparing all of these vaccination, and they are supervising the vaccination at the hospitals. The rapid tests that we talked about before that are only conducted in laboratories run by pharmacists or physicians, but not in community pharmacy. The community pharmacists, they are doing well also by educating people, and they were also involved in the airports to, let's say, doing some tests at the airports, welcoming people coming through our country. But frankly, we had some problems. Let's say, I will try to explain some issues that we had. First of all, we used to make seminars. They were conducted for professionals, for pharmacists, all over the Lebanon, to explain let's say, the diseases for pharmacists and what information should be given to patients, information about treatment. And these information, they were transmitted to the patients through, directly by printing papers or QR codes. Actually, now we cannot continue, we should not continue, let's say, we could not continue through the pandemic, COVID pandemic, by being present with these seminars. So we did it, it were converted to digital events. So these digital events, it should be, let's say, now we should restore the presence and the seminar we had before by the presence of the pharmacists individually in conferences. This is one of the issues we have to discuss. The other one is the problem that we had is the home drug-free delivery. We had it here in Lebanon, actually. So pharmacists, they are sending, some of them, drugs to the patients, free delivery. Unfortunately, this behavior, it attracted a lot of countries around us. Now we had, let's say, we have from Egypt and from Turkey. They are making announcement that we can bring you medicine because we have a lot of shortage due to our economic problem. Actually, they announced that we can bring you medicine from Egypt, from Turkey within 3 days, and by delivery. So can you imagine selling medicine from country to country by delivery without being, let's say, passing through the Ministry of Public Health, the control, all the tests? This is another issue that we should stop in Lebanon. I believe that this free home delivery is one of the paths of falsifying medicine, because at the beginning we may have good medicine coming to Lebanon, but after some times they will go to some area in the world where they falsified drugs and they will send it by free delivery to our country. This is why we are afraid we have to stop this maneuver, because it's a wrong behaving. The third issue I would like to say is the telepharmacy, the digital communication with the patients. This is happening actually sometimes, but I believe that we should not continue in that path, because the major let's say the major role of the pharmacist is to be a healthcare professional in connection with the patient, direct connection with the patient, for counseling, for dispensing the prescription. So he has to discuss with the patient personally, not through the digital communication. This is one of the problems that we should also maybe sometimes discuss it and have an opinion about. The last one is the vaccination. We are now preparing a project of law to let the pharmacist be the healthcare professional who can, as the physicians, be able to give the vaccination to the people. Usually we don't have it in Lebanon. Now we are preparing this law. We need from the FIPP a letter saying that it should be amended, the laws, to let the pharmacist give the vaccination to people, especially that the pharmacist is considered the most accessible healthcare professional. We can reach more patients at a faster rate than the other professions. Look, we should be the primary source for vaccines in the future. This is what we think we have to do in the near future.
Thank you so much. Very interesting also to see what you say, what has been advancing on in your opinion should be redressed instead of reactivated. But so thank you so much for your overview. And just broadly, Andras, on the question I was just raising, which services do you think should take priority in recovering after the pandemic that had to be stopped? Could you give us the European perspective there?
Well, I think the hospital sector was a tiny bit different from what we experienced in community pharmacies, because in my opinion, but fewer services were discontinued as such, but certainly the focus clearly shifted towards a system-wide sort of emergency mode, where capacities, resources, and the very purpose of the healthcare systems shifted towards dealing with the pandemic and treating the severely ill, infected people. This, however, did not mean that our usual patients with either chronic or acute diseases of non-COVID nature suddenly disappeared. They got better or stopped developing new symptoms and illnesses. Their treatment and their statistics are going to be a main area of discussion for the post-pandemic area, I think. There is, however, there are, however, two areas, or even I would say principles, that would need to be re-enabled or reinforced. And one is, like I hinted previously, is the evidence-based approach. And the other would be the reliance on authentic information, or the infodemic phenomena that we are looking at. So these areas I would like to highlight as topmost priorities for the future. And I sincerely believe that pharmacists do have an important role there as well. As being experts of medicinal therapies, I think it is imperative that we continue to step up and support evidence-based therapeutic decision-making, both for emerging and repurposed modalities, but also in general for all pharmacotherapies that our patients are receiving. And on top of that, being authentic and being the source of credible information towards both other healthcare professions and the general public is a must. And that's the only way I think that our profession can preserve and even enhance our duty to serve. And I saw that one of the questions in the Q&A section also hinted on the infodemic phenomenon around us. And it is, I think, of an unprecedented dimension that we are looking at. False or misinformation and the very loud nature of social media in terms of how these non-verified information sources can become quite apparent and very, very prominent. And basically, I think all healthcare professions have missed a sort of opportunity here to step up and be the voice of common sense, be the voice of reason. And others who are very loud and very agile on how social media works, they have took a step forward before us. And right now it is time to catch up and be authentic, because that's one of the most scarce resources these days available.
Thank you so very much. I will address the next question to Marriott again. In many countries, governments may not have included pharmacy in the pandemic or disaster preparedness plans. And actually, I think in many countries, they were not included in any plan once the pandemic emerged. How do you perceive that this has changed or will change because of the pandemic? And what actions are you or your member organizations planning in order to make your respective to include pharmacy in the next pandemic or disaster plan?
Thank you so much, Lars. And it's such a valuable and valid question, because I can only imagine South Africa is not the only country where this has happened. And again, it's so sad that it's a reality. But when the South African government started with the rollout this year, so maybe just for background, South Africa is still practicing in a two-sector healthcare system. So we have the public healthcare sector, which looks after the uninsured patients. That's around 75% of our population. And then we have the private sector looking after insured lives, or citizens that prefer to pay out of pocket or cash for their services. And that's roughly 25% of our population. So when the rollout started in January, so firstly, there was the training developed for healthcare workers that would like to offer vaccination, COVID-19 vaccination services. And we found that the registration programs to access these trainings was only restricted to this public sector healthcare workers. And that there was no way that a private sector individual not employed by government can access this. And it was sad that we had to motivate to our government to open the training up to any healthcare worker, whether it's private or public sector, to access that training and to be knowledgeable on the COVID-19 vaccine and how the government would like this to roll out. The second hiccup is then the opening of vaccination sites. And currently, big critique that our government is receiving is because their public health sectors only operates Monday to Friday. And that no COVID-19 vaccination is currently taking place over weekends in the public health sector, which I've just mentioned is majority, far majority of our population. And it's currently the private health sector that keeps vaccination sites running over weekends. It's also the private and healthcare sector facilities, which is mostly large, our community pharmacies, that offer services to both insured and uninsured lives, equally opportunity. So it is sad that from the start, the government didn't see pharmacy and specifically our very, very broad distribution of community pharmacies in every small town around the country, that they didn't, without even have to think about it, included the community pharmacies in their plans. So it's a pity, and I hope everybody will learn from this valid contribution that community pharmacies is making, so that history don't ever have to repeat itself again.
Thank you, Mariette. Amrai, would you say the situation is the same in Malaysia?
The situation is almost the same. Unfortunately, the focus still remains with the government that is familiar with, especially the doctors. However, we believe that as a profession, we have taken center stage with regards to our relevance to the community. Our expertise in supply chains and also drug development is something that actually we should be involved. We have also taken a proactive role for vaccination in its supply, advocacy and reporting of AEFI. But at the moment, we want to now move on to administration. So the Malaysian Pharmacy Society will continue to push into vaccination. In addition, we are looking at setting a vision statement for the profession going towards 2030, and a big part of it will be on resilience and the ability to react to pandemics and disaster. We will also continue to work closely with our worldwide professional network via FIPP and for frank exchange of information and learning, which will allow us to move faster. So what I'm trying to say is that this is just a beginning, even though it's now happening during the pandemic. So you must be given the chance to move forward in this area. This is something that is happening in my country at the moment.
Thank you so very much. And Chris, are community pharmacists involved in the preparedness planning in Australia?
Thank you, Lars. In Australia, I think previously, prior to the pandemic, the role of the pharmacist predominantly has been around logistics, so the supply and distribution of medications. And I think many governments around the world will be in the midst of planning their review of how they've handled the COVID pandemic, or once the pandemic has wound up, a review. And I think in Australia, one of the reflections will be an over-reliance on the secondary or tertiary healthcare sector rather than focusing on primary care, which has a greater footprint around the country, as we've heard just with the previous speakers. And I think there will be a greater appreciation of the primary care sector. I think also in Australia, we have some jurisdictional legislation differences between our states and territories, so that the way in which a pharmacist can practice would vary from state to state. And this has caused quite significant disruption, not only in the pharmacy profession, but elsewhere, in terms of a uniformed approach to how pharmacists are involved in the pandemic, because it does rely on state and territory governments then to enact legislation to enable what the federal government is hoping to achieve. And I think finally, my personal reflection on pandemic planning is really around the mental health and healthcare worker burnout that we are seeing. And I think that's something that hasn't been thought of before. And I think moving forward, we must reflect on how we preserve both the mental health and the physical health of our healthcare professionals, including pharmacists, because I can see that around the world, pharmacists are on the brink of burnout because of how long they've been involved in this pandemic and the long hours that they work and the care that they provide for their community and the mental health challenges that then come along with that. And I think one of the legacies, unfortunately, of this pandemic will be some of the mental health issues that we see amongst our professional colleagues. And I think pandemic planning moving forward must have a greater appreciation for how we better protect our health professionals such as pharmacists.
Thank you, Chris. I really agree. This is, you can say, a silent pandemic as well among healthcare professionals. Over to you, Julian.
Yes, thank you. I would ask every one of you to answer a simple question in 1 minute, and I ask you to respect the time. Which do you think were the main learnings from this pandemic? And we will start with Ismail, who has raised his hand for a long time. Please go on.
Okay, thank you. Well, 1 minute is time. I will talk about something is important for us, that we highlight the importance of the attitude of both the professional and individual in the context of their responsibility towards society. It was possible to provide a number of new services without the need of significant financial investment and with the use of material resources and personnel already available. They were the result of a need visualized at the time of pandemics. It is a lesson to have proven how we can move forward just by setting a goal. I think it's important, if you let me, to recover the face-to-face communication. I think that this is very important for us. For example, in Uruguay, before the pandemic, we had something that we call the pharmacy week, where we talk with the patient, we made education, and with the pandemic, we lost a lot with this. And these days in Uruguay, some of our colleagues are working in the education and in order to put vaccination in pharmacy. I think this is new for us. We have few pharmacies that are learning and they are preparing to do that in the next future.
Thank you, Ismail. Esteban?
Yes, thank you, Julian. Certainly, I think the pandemic can occur at any time, and governments and the WHO should be more aware and monitor possible sources of a possible new pandemic. And we were really crushed around the world. And also, I would like to mention that we must be critical as pharmacists to review all the information provided regarding the treatment options, especially when several papers are come out in different journals. We have to be critical as well in providing access to vaccines for the population around our countries. And of course, I believe that pharmacists should take an important leadership in education and working on misinformation for people. You know, with this Delta variant, it's most of the people that is being affected are the people who aren't vaccinated, and probably most of those people who aren't vaccinated is because they don't trust the vaccines, or they've been really accessing all this misinformation that's around there. I also believe that it came clear that there is a lot of inequity around the world, and also the WHO and every government, especially the first world governments, should work harder in reducing the inequity for either medications such as remdesivir or the COVID vaccines. Thank you.
Thank you, Esteban. Anna?
Oh, very shortly. I think that the main learnings are interprofessional collaboration. So our pharmacists and other healthcare professionals can work together, leveraging synergies in order to improve the healthcare system, given that, as we all know, the limited resources. Crisis management and preparedness. No country was ready, as we know, to deal with the pandemic. So we should considering underfunded healthcare systems and lack of preparation and contingency plans. So we can now prepare the future and learn how to investment can save resources for future healthcare emergencies. Boost digital transformation. I think the pharmacists are very, very aware and prepared to boost this digital change. And finally, healthcare for all. And I would like to recall here the words of the President of the European Commission, Ursula von der Leyen, that is saying no one is safe until everyone is safe. So we should commit ourselves to sustain health in the political agenda in our countries and worldwide, fund the healthcare system properly, to advocate for this, and invest in human resources and research and collaborate even more efficiently at the international level. Thank you.
Thank you, Anna. Yes, we can agree that no countries was ready to face the COVID-19. So any one of you, maybe Mariette, or as you want?
Thank you so much. If I can add, and to some extent, two of our colleagues have mentioned this already or touch on it, but our late President Nelson Mandela, used the words that education is the most powerful tool we can use to change the world. And this links to pharmacists being the most accessible healthcare worker, and pharmacists being exceptionally powerful in terms of our knowledge, our broad scientific background, our knowledge and our skills on vaccinations and virology. And we can use that to reduce the anxiety and fear, the misinformation and the disinformation that's among the public and our patients. And pharmacists must stand to become or to be recognized as reliable information sources.
Thank you, Mariette. Yes, it is a long fight. Ziya, do you want to say something?
Oui, merci, Julien. Bien sûr. I have main learning from this pandemic. I will have to say 5 points maybe. First of all, never forget, always remember what happened to us. Respect nature, preserve it. 1. 2, masks are useful tools. No flu this year due of wearing mask. 3, vaccines are powerful tools. We have to encourage people to do it, and the pharmacist must have a major role. 4, human beings have the means to deal with crisis. Resilience is part of our DNA. Never forget that. And 5, we have to respect science. Thank you very much.
Thank you, Ziya. And to finish, Amrari, please go on.
Okay, thank you. I think most of them, our colleagues actually have mentioned all the points. From my side, I agree with all the that have been spoken by other colleagues. I think we need to adapt, to the condition and remain flexible to pick up new technologies and ways, to get things done. As a profession, we need to work together internationally towards our common goal. We know that we, as part of the global movement, that we actually can serve the people, in many more ways that we can do. So I think we have to adapt to the condition and remain flexible is very, very important, because I think we are now waiting for post-pandemic, and we have to get used to the new normal. The new normal become, we have to go back, previously, and we hope we can get to that station so that we can meet in person later on.
Thank you. Rob, we can turn to the Q&A.
Yes, definitely.
Thank
you all very much for so far. And good to see that there's also, it spiked some questions in the question and answers.
Robert,
start.
Robert, sorry to interrupt. Perhaps we can, as moderators, wrap up the session and then afterwards introduce Gonzalo and then have the questions from the audience.
Perfect.
Is it okay with you?
That's a good idea. Thank you so much, Lars.
Okay, thank you. Well, I can wrap up my part first.
Yes, please.
Yes, I think that throughout the pandemic, and as we look ahead to better days to come, I think there has been a recognition of the role played by pharmacists and pharmacies, all categories. And we have also seen that a number of new services have been developed. And this is especially true in those countries that are looking to pharmacies and pharmacists to deploy and administer vaccinations and support COVID-19 testing, or by helping the most vulnerable people in the society by delivering medicines to their homes and by using the new technology like teleconsultations. And the role of the pharmacist is changing and will continue to evolve. And we can already see how this has happened, and it will continue to happen. And I think that customer apps, remote consultations, home deliveries, and well-being services have quickly become a way of life. And we must expect a lot of this to continue to happen even after the pandemic passes. So you can say that our work in the past has paid off and our future looks brighter than ever, I would say. Now over to you, Robert.
No, great. Thank you so much. I totally agree. That what I'm struck in how different and how wide the field of pharmacy is. Of course, we knew it. We're very active in FIPP, but it is amazing that the different aspects that various parts of the world are looking at. And also, I think one of the questions was how come that we were overseen as pharmacists in many of the regulations when starting this pandemic. I've seen it in my personal system too, within the Netherlands with the ICU COVID medication becoming shortages. It is great to see how pharmacists throughout the globe are taking their role and taking responsibility. And I think this is one of the key factors that many pharmacists share. We are people who solve problems. We're there, we're very accessible, and we solve. We don't go into discussions, but we solve problems. And I think this is a great state that I've been hearing, and everybody's doing it in their way, in the specific points that are most significant in their part, in their country or in their area. And I think it really shows the resilience that pharmacists have and the important role that they have and can have in future pandemics, perhaps too, being prepared. So Julian, would you?
Yes, you want me to ask the first question? Yeah, okay. Sorry, so we have actually 8 questions. 2 have been answered already. 9 questions. So I will start with, we already answered to the infodemics. So let's choose. From Aida Batista, I would like to hear from Anna the great effort done from all pharmaceutical sector to meet the needs of the patients related to delivery of medicines. Can you answer, Anna, please?
Thank you very much, Julian. Very shortly, I think that, and I thank Aida for the question raised. In Portugal, as I said, one of the learnings of these pandemics was that hospital pharmacists and community pharmacists were really closed. So finding a way to deliver medicines for patients that usually only goes to the hospital pharmacy, specialist or specialty medicines that usually are only available at hospital pharmacy. And during the pandemics, with a program that was built or starting to be built by the hospital pharmacists, with the colleagues of the community pharmacies, we were able to make available thousands and thousands of prescriptions and renewal prescriptions from the hospital pharmacy to the community pharmacy. But also, as was mentioned by previous speakers, the home care, the home delivery systems from the hospital pharmacists and from the community pharmacists. We boosted a lot the service, taking of course care of all the regulations and good practices for distribution of medicines. And this was a tremendous effort, but a program that was of utmost importance. Let me tell you that all the questionnaires and surveys that the Portuguese universities and the government has made related to the needs during the pandemics was very clear that almost 100% of the responders said that they were very satisfied how with the access to medicines during this period, which means that there was no there was not a gap or a flaw in this delivery system. I think I would point it out this as the most, I would say, achievement, a most successful achievement that we had during the pandemics, and I think that will stay for a long period or for the future between hospital pharmacists and community pharmacists. Of course, that information was not only a delivery service. That the digital health helped us a lot from the hospital pharmacy and from the community pharmacy, making available all the service and all the information, adverse drug reactions report, etc. So I think that it was a successful experience, and thank you for let me sharing this opportunity, all the accomplishments we made on that.
Thank you very much. And I'm seeing a very interesting question by Heather. She confines it to the community pharmacists, but I think it's a wider point. We've been seeing all these efforts by pharmacists. We've seen adopting, responding, and even heard about potential burnouts. And the question that Heather has is community pharmacies in your country ready when it comes to human resources to provide the new roles safely and effectively? Along with all that we have done and continue to do, is this the next cry out? Will there be a cry out for we need more pharmacists, or is it a matter of reprioritization? Please, any of the panelists, feel free to raise your hand and then answer this question. I think it's very interesting. Marit, please.
Thank you, Robert. That's a very, very great question. Something that we've been thinking about, or I think we're all aware of it, and it's not really something new. But I think what is important is also maybe that governments and policymakers, and I think most importantly, employers, maybe for the first time, or maybe since a very long time ago, realize the value of human capital and that they must look after this resource. Because if it wasn't for the healthcare workers, none of this would have been possible. So I think that's important to be attent. I'm not sure around the world, but in South Africa, especially our community pharmacy sector, I really don't like it when they refer to the retail sector, because retail just have a specific perception on commercialism and consumerism, which I don't really can link with professionalism. And it's because of that retail environment and that retail push for sales and service and meeting the needs and extended hours and things like that, that really contributes to this burnout and suffering sometimes of our colleagues and our healthcare workers. So I really hope that from the president right through to the employer, that they value the human capital that we have in healthcare workers, and that without that, none of this would have been possible.
Chris, would you please, you raised your hand there.
Thank you, Robert. Look, I agree. It is in part a human resource issue, and certainly we've had many pharmacists express to us that it has become more challenging to either hire or find new staff, or to find temporary pharmacists to fill short-term, say, vacation leave, for example, where people do need to have a break, particularly in regional and rural areas where access to health professionals anyway is at an all-time low. But I think the other component to that is the rate of change that has occurred has really fatigued people without any discernible endpoint in the pandemic. So we just don't know how long this is going to go on for. Hopefully the light is at the end of the tunnel and it's not a train coming the other way. But we can see that there is now some hope. But I think at the beginning of the pandemic, given the rate of change of health policy, the requirements for pharmacies to stay open when other health professionals like doctors and GPs close their doors, for pharmacists to do extended hours, and taking into consideration all that health policy change has just created fatigue for people. And even with short-term breaks, we've seen that people are still fatigued when they return back to work. And so it, for me, highlights the really critical role of professional organisations within each country across the globe, in that these professional organisations like PSA can provide support in terms of providing information for pharmacists to keep in front of those health policy changes, and to advocate for things like opening up borders to allow health professionals to transit so that health workforce and human capital can be relieved in some of those areas. So I think it's two components, not just human resources, but the rate of change and the length of the pandemic.
Esteban, I see you have raised your hand, and then Ismail.
Yes, Robert, thank you. I just wanted to mention also that we've been struggling in the hospitals with this burnout as well. It's been really hard for us to manage, when hospitals got really crowded. And at least what I saw in my country is that all human resources departments whether if it was public or private hospitals, they took very important measures to support physicians and pharmacists in order to take care of this situation. We had, for instance, for pharmacists who got infected by COVID-19, they had a paid leave, and they're also really great support by psychology and psychiatry in case if their burnout was really out of control. But I think that's something that, as Chris mentioned, one of the first questions, is really important to make a plan to avoid this kind of situations in future pandemics or situations of disaster. Thank you.
Thank you so very much. We have a number of questions linked to technology, and one of them is actually what is the more or less the role of the pharmacist in the future when everything becomes digital? Well, I think that pharmacists have a very important role in the future as well. The profession is changing, and it's of course about technology, but technology is a tool for us to enhance our services. It's about joining all the different types of technology together, coming together to enable us to do things in a smarter and better way. And of course, we can see a growing aspect of adults engaging with health technology like smart watches, etc., becoming more or less the standard in many countries. And I think that the pharmacists can actually lead the revolution, because as pharmacists become more involved in patients' care, we can better understand the needs of patients through the data that can come through so many different places. And the technology can also help healthcare practitioners along with the patients to make better, more informed decisions. As one example, pharmacists can think about medication adherence and what's possible with technology to collect more data points related to an individual's behavior. Right now, to some extent, you can say that adherence is to some extent subjective, based on a patient's reported adherence rates or gathered through different, in some countries, billing data. But of course, we will see a lot more of sensors, wearables, Internet of Things, enabled devices, and a general approach to collecting data from use in real time. We have the mobile apps, we have telehealth that has emerged a lot in many countries during the pandemic. We have the artificial intelligence processing the sheer amount of data coming from all the devices, wearables, and health records is imposing, but possible with analytical engines, of course, voice assistants and robotics and automation. Would you like to make a comment on this, Robert, as you are part of the FIPP's technology forum?
Yes, well, no, definitely. I think it's taking a great momentum now. And I think one of the aspects that is very much talking about evidence within hospitals, one of the things that we do see is there was so little evidence. And although the old-fashioned trials, in which large trials had to be set up to see whether a medication was effective or not, it will be going to real-world data in which we will be extracting information, have learning systems behind it to very quickly get more answers in pandemic situations, evidence-based by getting it is evidenced by real-world data, not a large style. So I think if you look at it that way, their machine learning extracting the huge amount of data that is available from ICE and intensive care units, but also other ways of looking at trials, like there's the REMAP-CAP, which was an adaptive trial, and using more and more technology. So I really do think it is a huge advantage. And I totally agree with you that pharmacists could play a leading role. Within hospitals, I would say we should take the leading role in looking at outcome measurements and then using smart technology to really get to the core of things. But also point of care testing. I think these are things that can be done in many, many ways. So lots of opportunities. And
yes, and it's also based on trust, which is the theme for the World Pharmacist Day as well. When there are so many different options out there, whom can you trust? Well, you can trust your pharmacist, because it is a science and evidence-based profession. I think that we are running out of time within 10 minutes. And today we would also like to present some news to all of you attending this digital event. We will be using this event to launch a new publication, the FIPP Vaccination Handbook for Pharmacists. And it is a pleasure to introduce Mr. Gonzalo Sousa do Pinto, the FIPP lead for practice development and transformation. Gonzalo, the stage is yours.
Thank you very much, Lars-Åke and Rob and Julian, for moderating such an interesting and exciting event, and for all the panelists for joining us today. And thank you also for the opportunity to use this event that is so much dealing specifically with the services that pharmacists have been providing to contribute to managing this pandemic and bringing it under control, and also how we can contribute to pandemic preparedness for any future pandemics. And in relation to that, several of the panel members have mentioned vaccination services and how these play an important role in pandemic control, as we have seen in all our countries. And in that context, FIPP is today launching, and it is my great pleasure to announce to you the launch of this FIPP Vaccination Handbook for Pharmacists, procedures, safety aspects, common risk points, and frequently asked questions. This is a publication that, if I can have the next slide, please, Ruben, thank you. The aims of this publication is really to support individual pharmacists with understanding the variety of roles that pharmacists can play in the vaccination area, ranging from patient education and advice and building on and harnessing the trust that several of the speakers have mentioned as well today, the reliability of the advice of pharmacists, but also several logistical roles, and also, of course, in the administration of vaccines. One of the members of the audience had asked before what was the situation in terms of the vaccination and the roles of pharmacists, and we know from FIPP data that we currently have around 39 to 40 countries where pharmacists or pharmacies are involved in delivering vaccination services. And we've seen that some countries have introduced the service during the pandemic. So we're hoping that this new resource by FIPP can also provide guidance for the practical implementation of these services around the world. And really to provide these guidelines on the main procedures, on the safety aspects of vaccination, what are the main risk points and what are the most common errors as well in the process, so that we need to understand them and be aware of them to avoid making these errors. And also we have listed and included in this document several frequently asked questions about vaccines and their administration. Naturally, many of our member organizations provide training and certify the competence of pharmacists to deliver vaccination services. So it's not the goal of this publication at all to replace that training and that certification of competence, of course, but really just to describe the roles that pharmacists can play, so that there is a general understanding across our profession, but also to communicate it outside of the profession, what roles that pharmacists can play, and how this publication may help them in their daily practice in gaining this overview of different roles. Next slide, please. Thank you. So in terms of the contents of this publication, we start with an introduction where we describe a number of concepts around vaccinology and vaccination, the types of vaccines, and many other concepts, how safety is built into vaccine development. That's a very important message for us to understand and to be able to share with our communities, and to address the anxiety and the concerns that there may be in relation to the safety and the efficacy of vaccines. But also there's a variety of chapters that deal with specific services in the area of patient education or community education, advocacy and promotion of vaccination, the roles that pharmacists can play in the logistics of vaccines, including supply chain management and also cold storage and cold chain management, the roles that we can play around using and having access to vaccination records so that we can use that information to identify gaps in vaccination records, in the vaccination of individuals, and identify the vaccines that each person may benefit from or may need, so we can really address that need and either provide the vaccination ourselves or refer the person to those other health professionals that can deliver those vaccines. And also in some countries that pharmacists have a role in facilitating vaccination appointments. Finally, we have two chapters, one of them that deals with the requirements for vaccine administration. So what needs to be in place at a pharmacy, spatial requirements, material requirements, training requirements, although the training element will be the scope within the scope of a different publication that FIPP will publish soon on that as a companion publication to this one. And then finally, we have a more detailed chapter, which is the core of this publication, really describing the procedures and the risk points and potential areas around vaccine administration in 3 different phases. Now, the pre-administration, what needs to be checked, what needs to be in place, then the administration itself, the technique, what concerns need to be checked, let's say, to ensure adequate administration, and then in the post-administration phase, including the management of adverse events. Next slide, please. So I would like to take this opportunity to thank Ruben Viegas, who was the lead author of this publication, and he's with us on this event, Holly Cook and Amy Chan from the University of Auckland in New Zealand as well, and to Professor Lisa Neeson, who has contributed with a foreword to this publication as a world-renowned expert in pharmacies-led vaccination. Also thank our sponsor, GlaxoSmithKline Vaccines or Biologicals, for providing support via unrestricted funds to develop this publication, to highlight that also that the authors and editors have worked independently to produce this resource. And next slide. So here you have the link and the QR code that you can use to access this publication on the FIPP website. And that's it. Thank you very much. So I think that we have a few minutes left just to wrap up the event. Back to you, Lars-Åke. Thank you very much.
Thank you so very, very much, Gonzalo, for this very interesting news and toolkit. Make every contact count, actually, is the key message as we now launch this vaccination handbook for pharmacists today. Very, very important step forwards, and also I would say linked to the pandemic preparedness that we discussed earlier. I would like to take this opportunity to thank you all for being with us today. You have been attending and viewing us online, and especially a big thank you to our distinguished speakers who have shared their views, experiences, and provided us with wise input and advice. It has been indeed a great honor to have you with us today. Robert, over to you.
Great, thank you. Well, I can just acknowledge your thanks to the team. It really is special having such a broad view from all the different parts of the world. And it's been inspiring preparing for this meeting, and it's been inspiring hearing this. And it's very great having all these participants listening, and I do hope you are inspired. Please join the FIPP community, become part of our community. And again, thank you for joining this session, and everybody is open for questions whenever you need. You can contact FIPP. And great that the 3 sections work together for this webinar.
So I have to conclude, and I will resume what I'm reading actually in the chat. Thank you, everyone, and thank you for attending this event. And take care and be safe.
and join us on this Twitter event regarding universal health coverage tomorrow at 8 o'clock European Central Summer Time. It's a great opportunity to chat with our Chief Executive Officer, Dr. Catherine Duggan, as well. So take this opportunity tomorrow to join us on Twitter. So thank you so very much, all of you. It has been a great honor to have you with us today, and we will look forward to meet you soon again. Goodbye.
Bye.
Bye-bye. Thank you.
Thank you.
Thank you very much. Goodbye.
Thank you very much. Bye.